Hi, I'm Patty Robinson, and I'm a psychologist, and talking with you today about mental health services. I have 5 strategies I'm recommending for improving the mental health system. First, I think we need to shift to whole person centered care. Really, the idea of separated mental and physical health care has never worked very well because people come as whole people. Indeed, the head is connected to the body. Locating mental health services in primary care encourages this whole person kind of perspective in providing mental health care. Second, I think we need to incentivize integration of behavioral health services in primary care. The federal government has done this in recent decades by making grant funding accessible to healthcare services that want to do something different and bring behavioral health or mental health into primary care as something that's just a part of routine good care. However, at this point in time, many communities continue to lack this integrated healthcare approach in this important area of mental and physical, all there together. Next is creating some new training approaches. Specifically, I'm recommending that we start to provide interprofessional classes at the undergraduate level for students interested in healthcare careers. Really, from the beginning, I think our healthcare providers of tomorrow need to work together, start to think together as a team, and to speak a common language about behavior change and pursuing well being. Fourth, I'm recommending systematically encouraging um, a new perspective on what mental health care looks like. I think mental health care needs to look like something that's focused on helping people function and live their best lives, teaching them the skills they need to make better choices and to create stronger relationships with their family and friends and connections with their community. I think this is probably a lot more important to the well-being of people than a diagnosis, kind of digging into what's wrong with them. The fifth thing that I recommend for improving mental health services is that we began to use metrics to evaluate what are the results of delivering mental health services. I think specifically our metrics should give us an idea of what's happening at the individual clinician patient level. So be clinically relevant to assessment and intervening, and at the same time, important to aggregate or looking at what is the overall impact of these services being delivered by these providers. So at the population level. Second area of metrics that I think so important is we think through what are we measuring that really describes the experience of people that receive mental health services. For example, how long did they have to wait for the service? How helpful did they feel that service was immediately after receiving it, and maybe a little ways down the road as well? So that's it for the day for today. 5 strategies. I think we can do it. Let's go to it. Um, Mental health system, it's not completely broken. It's just stuck in some ways, and there's ways to fix it. Thanks.